Ozempic continues to be the hot trend in weight loss, but we still have so many questions whenever it's brought up. Thankfully, we have the one and only Dr. Kohli. Yes, Dr. Kohli. So many questions.
So many. I have a question about Meghan McCain specifically. About a month ago, Meghan McCain gave birth Mazel Tov, and she just realized that she is being urged to take Ozempic by people close to her, which she says is, quote, horrifying. I think we can all agree that is disgusting. Is Ozempic safe for pregnant people so soon after a child, breastfeeding?
Guys, how do we get here? I mean, this is a drug designed for obesity, which is a chronic health problem. It is not meant to fat shame pregnant women a month after delivery when you know that they have extra weight on them. And usually you lose most of that weight in the first 6 weeks, but it can take, as you might say, Sam, up to a year to lose all of that weight. And so this is not the design of the drug, so it's not an appropriate indication for the drug, and it's completely unsafe that society is expecting now pregnant women who might be breastfeeding, as you said, Tori, or have other hormonal shifts or blood pressure shifts, to start using injection medicines to try to lose the weight at a time when they should be thinking about bonding with their baby and enjoying the changes that happen in your body that are natural with pregnancy.
I think that's just so hard, because if there's a group of women that get pregnant around the same time, one of them takes Ozempic post childbirth and looks great, and how many comments underneath their pictures, Tori, you look great, Tori, before Sam and Dr. Kohli are like, maybe I should do that. Mm-hmm. I mean, it is a thing. I mean, the psychological damage is put on women is its own cottage industry in this country and all over the world. So I guess we can't pretend like we're shocked by this.
But
even
who's
though
prescribing that Ozempic? We have to hold people accountable if they're facilitating this culture of using this recreationally, using this at a time in your life when you really shouldn't be using it. It's not safe, it's not indicated, and abusing it, quite frankly, when it's meant for people who are struggling with obesity and they've tried everything else.
All right, Doc, so speaking of Ozempic, a new article talks about our obsession with it and how that's leading people to neglect normal diet and exercise. So do people gain the weight back quickly after they stop taking Ozempic?
You can gain it back. In fact, the studies tell us that the majority of people that stop the Ozempic will end up gaining the weight back over a year or so. So it's really, again, sort of designed to be part of a comprehensive program in terms of weight management. Now, we don't know how much of that is physiologic or how much of that is behavioral. Like, when you're on Ozempic, you can feel like you can eat whatever, and your appetite is different. And then if you don't change your behavior accordingly, when you get off the Ozempic, that could be different as well. So it's looking like it's going to be a chronic drug, just like hypertension or diabetes. But even with diabetes, there are patients that I've had who lose weight, change their diet, they can get off their insulin. So I want to empower people to believe that it is possible to use this as needed to achieve their goals, and then talk to their doctor about whether it makes sense to trial off and see what happens. But this is kind of one part of a big plan to change our behavior.
Lifestyle change.
Yeah. Well, speaking of lifestyle changes, Canada a couple weeks ago told us couldn't drink as much beer. I think they said 1 drink a week.
2 drinks a week.
Yeah, okay, wow. I don't even drink. I don't even drink anymore, and that's not that much. and now they're saying we're drinking too much coffee, Doc. That's my one vice. Now, how many cups of coffee is okay?
Drink, Dr. Jackson?
I have one. I switched over to black coffee, so I'm drinking like old school, like a police dispatcher. Yeah, me too. So I'll do a black cup of coffee in the morning, and then I'll do one at work. Shout out to Steve. So I'll do 2 a day.
Everything we put inside our body, guys, it's a drug. Our body has to metabolize it. So caffeine is no different, so we put caffeine in the body and our body has to break it down. Now, some of us, interestingly enough, and this is the new part that's emerged in the science, are slow metabolizers of caffeine. And it's about half of us. So sitting up here, a few of us will metabolize caffeine much slower, which means that the toxic effects, if we consume a large dose, are going to be more detrimental for our organs. And so the study that just came out in JAMA tells us that if we're slow metabolizer and we drink heavy consumption, which
what is heavy?
Yeah, what 3 or more, which they say 3 or more cups a day.
But you go to like a Starbucks and they'll put
A
2
Trenti,
shots or 3 shots in there, 4 shots for a Trenti.
Yeah.
So do you just ask for like a 1 shot?
Great point, exactly.
Of
So
espresso.
every shot of espresso is about 100 milligrams of caffeine. So the FDA says stay under 400 milligrams, which is 4 cups. But some of these studies are telling us that even at 300 milligrams or 250 milligrams, which is 2.5 or 3 cups, you can start to see some of those detrimental effects, especially if you're that slow metabolizer.
And it goes into the kidneys? That's what they're seeing? Kidney disease?
It can cause kidney disease. It can cause high blood pressure. It can increase your risk for heart disease. It can cause, obviously, anxiety, tremulousness, all of the mental and psychological benefits, because you just have more of that drug in your system.
Does it matter if it's coffee caffeine versus like green tea caffeine?
Doesn't matter.
Yeah, I know.
Although
green tea.
So coffee does have some antioxidant things and other things that are beneficial for health.
That's what I remember hearing.
But these are associated with health benefits. So it could be that you're drinking your coffee, you're actually taking better care of yourself. It's not necessarily the coffee, but some of the other things that you're doing. Jeff's sauna, for example, that could be resulting.
Do you ever have coffee in your sauna?
No. But I'm sure the pharmaceutical companies will come out with some pill so you can drink more coffee. So rest assured, everybody. Yeah.
Dr. Kohli, thank you so much for being here. We appreciate you answering all of our questions. You can follow Dr. Kohli on Twitter at Payal Kohli MD.